Hello, how are you? So, according to my records, we have you in today for a routine ear procedure. Just before we continue, and to make sure that you're who you say you are, can you just give me your first name, please? And your middle name? And your surname? Can I also please take the first line of your home address and your postcode? And your contact telephone number. And finally, your email address. Yeah, we are still making the change to being completely paper-light, so it is preferential for us to send any communications or forms of correspondence via email. Is that okay with you? Thanks. Okay. So, today, what we'll be doing is taking a look at your ears, getting in really close and taking a look inside, just to make sure that they're all right. So that'll be both ears. And then we'll be performing some minor reconstructive surgery, just to make sure that everything's working okay. So after the examination is complete, what I'll be doing is I'll be getting in there with some tools, and we'll be reshaping the outer and inner ear so that it can work a little bit more effectively and you can hear as well as possible. Okay? Absolutely nothing to worry about. There will be a local anaesthetic in the area I'll be working, and to reconstruct elements of the ear, what we actually do, because the ear is predominantly cartilage, we use hair, woven hair, so it's all very natural, very soft, and should end up looking perfect. Okay, so without any further ado, and if it's all right with you, I'd like to get started, and we'll start by taking a look in your left ear, and I'll just be examining it with an otoscope and explaining to you exactly what I'm doing and looking at while I'm there, and we will go from there. So just let me pop some gloves on. I always do this bit. When I put the gloves on, I always make the small talk. How's your week been? I'm on a double shift, which kind of explains my creased shirt. Or does it? No, I've just been very lazy with the ironing recently. But don't judge me. Okay. So, the first thing in my bag of tricks is, of course, the otoscope. And what I'm going to be doing is taking a really deep look inside your ear and telling you what I'm looking at, what I'm doing, and what we're looking for. Okay? So with that in mind, is it alright if I take a look in your left ear first? Thank you. I will actually, my desk is here, so I'm going to go around that way to the back of you. Okay? Thank you. Okay. Just let me get in nice and close. Don't worry, I'm still here. I will talk very gently because obviously I'm very close up to your ear and I don't want to damage your eardrum. So, first of all, I'm going to examine the outer ear. So I'm going to start on the furthest outside point, which is actually your anti-helix. So that's the rim around the edge of your ear. And I'm just going to squeeze that gently, just to make sure that it reacts appropriately. And the anti-helix, he heads up to the helix, which is the top of your ear. So just having a look there. This is all above. The bit that I'm stroking now is the anti-helical fold. Okay. I'm going to go down to the earlobe, the lobule. Okay. So just hope you're okay. I'm just going to squeeze the end of your earlobe. Is that okay? Good. And we're working on around to the tragus. Now, this is the bit that you can push down over the ear canal. Okay, I'm just going to push it very gently. Okay, and then we have the concha, which leads down to the antitragus. And then all the external auditory meters as well. Okay, and that all looks good to me. Now, it is very hot in the practice, so don't worry if you get a bit sweaty. Everyone is. Now, all of this, the pinner and everything, which is the top part, this is all part of the outer ear. And what a lot of people don't know is that your eardrum is kind of almost part of the outer ear as well. It's part of the middle ear. So what I'm going to do now, so the outer part of your ear is to do with air vibration. It's to do with basically protecting the inside of your ear, amplification, and used for the localization of sound as well. It's your antenna, if you like, and that leads down to all the highly sophisticated stuff, which we're just going to take a look at now. So I've got my little otoscope here, and what I'm going to do is just basically pull back on the pinner very gently, the helix, pull that back, and I'm going to pop the otoscope inside your ear. Okay. And there we go. You shouldn't feel any discomfort. And what we're looking for here is inflammation of the eardrum, or the tympanic membrane, any sort of infection, or any sign of it being split. And it's all in your brain. And of course your eardrum is the base of the concha, which is the entryway to your ear. Okay, I'm going to pull out the otoscope now. Okay. Okay. How are you feeling? Was that alright? So now, I know it's a little boring, but we're going to do exactly the same thing in the other ear. I'll talk to you again about all the bits that I'm looking at, as well as making sure that you're comfortable and getting as thorough look in your right ear as I possibly can. Okay? So again, I'll start off by with an external examination of the ear, followed by getting into the nitty-gritty. Okay? Right. So let me just take a look at the external part of the ear first. So, the pinner, or the helix. Which we have there. And around so as I said before, I'm just going to pinch your earlobe. The outer ear is responsible for air vibration, and it functions as a form of protection. For the rest of the middle ear is to do it's important that everything inside your ear is in perfect harmony, not just for sound, but so that you can stay upright. Okay, just taking a look at your concha. Go to the anti-helix and taking a look at the anti-tragus as well. Okay, perfect. Now, before I get this little bad boy, boop boop boop. Hello. And just put this in your ear. So I'm going to hold back the pinner again. So get ready. Okay. Pop that in there. This is going down the concha. And I'm just taking a look at your middle ear. There you go. Tympanic membrane. Now beyond the tympanic membrane is the inner ear. And this is to do with mechanical, hydrodynamic and electrochemical functionality, which is to do with the filtering and distribution and transit action of hearing process. All of this has the semicircular canals, the vestibules and stuff like that that lead on to the cochlea and eventually to the internal auditory canal, which is part of the nervous system. Which is how we hear. Okay. All looking very good, very pleased. So, let's see how we're looking overall. Okay. Thank you very much for being so patient. Patient. Yeah, we have to make a lot of jokes like that to pass the time. Now, one thing I will say, and it's no reflection on your level of hygiene or your cleanliness or anything like that, but one thing we do need to do is a very quick ear cleaning, and we're going to do that in the simplest way possible. I'm going to be putting a solution into each of your ears that will make a light fizzing sound when I do so, and this will just help to disperse some of the cerumen or wax that's built up, the excess wax. We don't want to get rid of too much, as I've explained to you before. After this, I'll use a tool to scrape out any residual wax and we'll be done. Then we can move on to the surgical aspect of the procedure. Is that alright? Good. So, first off, let's get some fluid in each ear and we'll do one ear at a time. So, do your left ear first. You ready? That's it. Your right ear. And that is it again. And you will start to hear both of them fizz out as you do. I know it sounds intimidating, but don't worry. As famous doctors always say, this won't hurt a bit. Okay, so now while that's gently fizzing away, I'm going to use this tip, which is spatulate and tapered at the end, so that we can get in nicely into your ear. It can't be done by yourself, you have to have somebody else to operate it, otherwise the sharp edge could damage your ear canal. But you can trust me. You can trust me. It's okay. So I'll stay in front of you, but I will just straddle you a little bit, if that's all right, and take a look in your left ear first. It'll still fizz as I work, but don't worry, this is just how we get all the residual and excess wax out. Okay, here we go. Just scraping away very gently. That excess wax. How does that feel? It shouldn't hurt. If it hurts, tell me straight away, and boop, we'll be done. Okay. But basically, what we're doing is taking out just enough so that your ear can still remain protected from the sound, which does work to protect you and stop alien bodies from getting inside your ear, as well as the spread of infection. So we don't want to take away too much. It is an exceptionally hot day, but a wonderful day to see an old friend. And there we go. Okay, good. So we get another tool. No, you're right here. Okay. Same again, please. Straight in and just try and get rid of any excess wax that we might have. As you can hear a low humming in the background, it's because we've got the fans on. We don't have AC at the clinic. I know. It can make it all a little unbearable sometimes, trust me. Well, I know a lot of people don't have AC in the UK. I think the UK is ill prepared for any kind of adverse weather. In a way, the UK is only happy when there is no weather, which never happens, but we're not prepared for anything else. Okay, perfect. Loving your ears here. Beautiful. Okay. Okay. How are you feeling? Excuse me. How are you feeling? Okay, good. So that's the ear cleaning portion. There might be a little bit of residual spillage from the solution that I used earlier, but otherwise your ear canal is A-OK and ready for us to take a look at with our surgeon hat on. So I need to change my gloves because these are full of sweat. Attractive, I know. Let's put some new ones on. Your hearing should have improved a little bit. Yeah, the entire procedure shouldn't take long at all. It's just about reconstructing certain aspects of your ear and just making sure that everything's working perfectly. If I can get these damn gloves on, right? Good grief. Okay, So first of all, we need a scalpel, which we're going to use for some of the reconstruction. Nothing to worry about. I'm going to spray your ears with an adhesive gel. Next, I'm going to take a syringe. Pop it in your left ear. 1, 3, 2, 1. That's that one. And then your right ear. 3, 2, 1. Perfect. Your ears will go numb, but you don't really feel much through them anyway, so no biggie. Just wipe down your face a little bit, got a little bit mucky. Perfect. Okay, now I'm going to make the first incision, and we're going to start with your left ear, okay? Just getting in there, just to tidy things up a little bit. Let me get a little bit further around. Okay. Good. And without further ado, we're going to go straight on to righty. Okay. Again, I'll be getting in quite close, okay? Okay, just one more time. Adhesive spray. And what will happen is that your ears will naturally start to recoagulate and absorb the cartilage that I wove in to your ears as we were working on them. It should take a day to heal. I prescribe you a day off work. Yeah, your favourite doctor again. And then you should feel a complete return to normalcy in terms of your hearing. Okay? Until the next time, you take care, and it's always a pleasure to see you.